Have you ever looked in the mirror and wondered if you're normal? Have you ever compared yourself to images online, to locker room talk, or even to your own imagination, and felt a wave of doubt? If so, you're not alone. Millions of men carry private insecurities about penis size, insecurities that can quietly eat away at confidence, intimacy, and self-esteem. But here's the shocking truth. Most of what you think you know about penis size is completely wrong. Today, we're cutting through the myths, the distortions, and the shame, and replacing them with science, perspective, and real solutions that can transform how you feel and how you perform. Let's start with why this conversation is so important. For many men, penis size isn't just a curiosity. It becomes tied to identity and self-worth. From adolescence onward, we form our perceptions based on unreliable sources. Adult films, cultural exaggerations, and casual locker room jokes create a false benchmark of what's normal. But the problem is, none of these are accurate. Research shows that up to 60% of men feel dissatisfied with their size. Yet scientifically, more than 90% fall well within the normal range. So why the disconnect? It starts with comparison, and comparison begins young. Think about the first time you were exposed to adult content. What you saw there was staged for maximum visual impact. Actors chosen specifically for above-average size, filmed with clever camera angles, and enhanced with lighting, editing, and sometimes even digital effects. That unrealistic image becomes your mental reference point, and it sticks for years. Add in casual talk, joking, or even teasing among peers, and suddenly an average, healthy body can feel like it's not enough. But here's what most men never hear. When women are surveyed, only about 5 to 10% say size is very important in a partner. The majority care far more about confidence, connection, and presence than about measurement. Yet almost no one told you this in health class. Today, we're going to change that. Before we talk about averages, let's clear up one big issue: measurement mistakes. Measuring incorrectly is like stepping on a broken scale. You'll never get the right number. Common mistakes include starting at the skin instead of the pubic bone, measuring from underneath instead of from the top, or measuring when the body is cold, anxious, or not fully aroused. Some men overstretch while others don't stretch enough when flaccid. All of these give misleading results. In medical research, we use something called the flaccid stretch length. Here's how to do it correctly. Stand upright. Use a ruler or soft measuring tape. Place it on top of the penis, starting at the pubic bone, and press gently into the fat pad. While flaccid, gently stretch the penis forward to its natural full length, firmly but without pain. Measure from the base to the tip. For girth, wrap a soft tape or string around the thickest part of the shaft, mark where it overlaps, then measure that. That's the accurate method researchers use to assess size. Now let's look at what the science actually shows. A landmark study published in 2015 analyzed data from over 15,000 men worldwide. Here's what it found. The average erect length is 13.2 centimeters, just over 5 inches. The average erect girth is 11.5 centimeters, about 4.5 inches. About 90 to 95% of men fall between 10 and 16 centimeters, roughly 4 to 6.3 inches in length. If you're anywhere in that range, you are scientifically and medically normal. The extremes, micropenis under 7.5 centimeters and macropenis over 24 centimeters, are rare and should never be seen as benchmarks for masculinity. So why do so many men feel smaller than they actually are? Because perception is skewed. Adult entertainment sets a false baseline. Comparing yourself cold or relaxed to someone fully aroused and enhanced is unfair. And the penis itself changes in appearance depending on temperature, stress, and blood flow. This brings us to an important warning. Research from UCLA shows that most men who pursue enlargement surgery already fall within the normal range. And even after surgery, up to 40% remain dissatisfied. Why? Because the issue isn't physical. It's psychological. The risks are serious: scarring, reduced sensation, erectile dysfunction, and in some cases permanent deformity. Even more surprising, beyond a certain size, bigger does not equal better satisfaction. In fact, it can cause discomfort for your partner. So if chasing more isn't the answer, what is? If you're finding this eye-opening so far, make sure to hit that subscribe button. We share science-backed insights on health, confidence, and intimacy for both men and women. Don't miss out on the tools that can transform your life. Now let's get practical. Here are the real, evidence-based tools that can make a genuine difference. Tool 1. Reduce excess fat around the pubic area. Carrying extra weight can create the illusion of a shorter penis. In fact, losing just 2 inches off your waist can reveal up to 1.2 centimeters of visible length. That's not a trick. It's simple anatomy. Tool 2. Improve blood flow. The penis is a vascular organ, and circulation determines fullness. Eating nitrate-rich foods like beets, spinach, and arugula improves blood flow. Supplements like L-citrulline or L-arginine can help, but only under medical guidance. Stay hydrated, quit smoking, and yes, do pelvic floor exercises. Kegels aren't just for women. They improve control, strength, and circulation for men too. Tool 3. Optimize your hormones. Testosterone drives libido, circulation, and tissue responsiveness. If your levels are low, everything suffers. Get a full hormone panel. Total and free testosterone, SHBG, and estradiol. Natural boosters include better sleep, strength training, more zinc, and reducing alcohol. If needed, consider medically supervised therapy. Tool 4. Stop comparing, start connecting. Satisfaction and intimacy comes from connection, confidence, and presence, not a number. Stop letting distorted images dictate your worth. Tool 5. Seek guidance before any enhancement. If your drive for enlargement comes from insecurity, speak to a therapist first. Body dysmorphia is real, and surgery often makes it worse if the underlying issue hasn't been addressed. Here's the truth. The overwhelming majority of men are completely normal. You don't need to be above average to have a satisfying, healthy sex life. What you do need is self-respect, accurate knowledge, and habits that optimize your health. When you stop obsessing over size and start focusing on your body, your health, and your confidence, everything changes. Your performance improves. Your relationships deepen. Your confidence grows. So ask yourself, what's more powerful? Chasing a number, or mastering your health and your confidence? The answer is clear. If this video gave you clarity, consider subscribing to The Healthy Body. Here, we explore topics that matter, not just for men, but for women too. From hormones to intimacy to confidence, we bring science and empathy together to help you live your healthiest life. And remember this: you were never too small. You were simply never told the truth. This is Dr. Alex from The Healthy Body. Until next time, take care of yourself and your health.